Welcome to Moonleaf Satellite.
I'm Bianca.
And I'm Charlene. We're coming to you live and direct from Baguio City.
Today's top story: STD cases increased. But before we talk about today's top story, let us first tackle what is STD.
We have 3 special reporters standing by, ready to give news from the field, presenting some of the facts about sexually transmitted diseases, or commonly known as STD. Now, let's go to our first field reporter.
Is STD. It is often referred to as sexually transmitted infection. It is a disease or infection that may be transmitted by human sexual behavior, which includes intercourse, oral and/or anal sex. It may also be transmitted through IV, needles, or during birth. Examples of STD: chlamydia and gonorrhea, which are caused by bacterial infections. HPV and HIV, caused by viral infections. Public lice and scabies, caused by parasites. And also trichomoniasis, caused by protozoal infections. Hazel Ganapin, reporting.
The World Health Organization estimates that 340 million cases of syphilis, gonorrhea, chlamydia, and trichomoniasis occurred throughout the world in 1999 in men and women aged 15 to 49 years. It is estimated that around 92 million chlamydia infections occurred worldwide in 1999, affecting more women than men. An estimated 62.35 million cases of gonorrhea occurred in 1999, affecting more women than men. An estimated 12.22 million cases of syphilis occurred worldwide in 1999. Sexually transmitted diseases are a major global cause of acute illness, infertility, long-term disability, and death, with severe medical and psychological consequences for millions of men, women, and children.
So here's a little history about STD. Do you know that the first recorded infections were those of syphilis in 15th century Italy? When the French invaded, the soldiers took it back to France, and from there it spread to the rest of Europe. In only 2 generations, the disease had mutated into the form that is commonly known today. Early occurrences of STDs were untreatable by medicine of the time, and the sufferer often died. It was only with the creation of antibiotics that the diseases were not perceived as life-threatening after that point. In fact, antibiotics made the general public feel that STDs were no longer a threat, easily treatable, and not something to really worry about. However, this is a misconception about antibiotics, because antibiotics are successful only at curing bacterial infections.
Do you know that the Philippines has one of the highest incidence rate of sexually transmitted disease here in Southeast Asia? Basing from statistics, STD cases increased 70%. From 157 cases, became 267. It is also observed that most of the cases were due to the increase of MSM, or men having sex with men. Senator Miriam Defensor suggested that people should be educated with this kind of topic to lessen the cases of STD here in the Philippines.
Vaginosis is an infection of the human vagina that may be caused by anaerobic bacteria, also characterized by excessive, sometimes malodorous discharge. inflammatory skin disease caused by herpes simplex virus. It is also an eruption of groups of deep-seated vesicles on erythematous bases. Trichomoniasis is a disease caused by infection with a species of protozoans of the genus Trichomonas or related genera.
These are factors making a person susceptible to STD. Young age, especially at 15 to 24 years old, unmarried status, new sexual partners, multiple sexual partners, history of prior STD, residence in an urban area, African American race, illicit drug use, meeting partners on the internet, and admission to a correctional facility or juvenile detention center.
Hi, can I ask you something?
Yes po.
How do you think STD is transmitted?
STD is transmitted when someone who has an STD have a sexual intercourse with another person.
Thank you for the information. Do you know that STD is not only transmitted through sexual intercourse? It can also be transmitted through direct contact with contaminated blood and through birth when the mother is infected with STD.
How could you not wear a condom in today's world?
A condom, genius. Did you use a condom?
Oh, well, no.
But seriously, how could you not wear a condom? I've been with the missus for as long as I can remember, and we still make sure to have plenty of condoms on hand. Anyway, it looks like you've got yourself an STD.
What can help you determine if you have STD? Some signs and symptoms of STD would include fever, painful urination, painful sexual intercourse, unusual vaginal discharge, and irritation of the genitals.
Okay, chicos, same thing goes for you. If it burns when you pee-pee, then you might have some sort of STD, man. Yeah. Damn. This motherfucker so big. Two-handed bits in this motherfucker. Spice.
Risks or complications of STD. Permanent damage to reproductive organs causing infertility. Ectopic pregnancy that can rupture the fallopian tube, causing severe pain, internal bleeding, and even death. Pregnant women with STD may deliver premature low birth weight babies. It can also increase risk of getting or spreading other sexually transmitted diseases.
Sexually transmitted diseases are both common and preventable causes of morbidity and serious medical complications. Untreated chlamydia and gonococcal infections can lead to pelvic inflammatory disease, or PID. PID leads to infertility, ectopic pregnancy, which is a pregnancy within the fallopian tube, or chronic pelvic pain in approximately 10 to 20% of all cases. Human papillomavirus causes genital warts and cervical cancer.
Let's ask some people if they have an idea on how to prevent STD. Do you have any idea on how to avoid STD?
Based on what we learned on our subject, public health, I think STDs can be prevented through the use of contraceptives.
Thank you.
The only way to 100% prevent a sexually transmitted disease is by abstinence. Abstinence allows a person to gain years of age and years of maturity before getting themselves involved in an intimate relationship. There are also vaccines available against hepatitis A, hepatitis B, and human papillomavirus. Knowing your partner well before you become involved in an intimate relationship and considering testing for yourself and a new partner prior to intimacy are also good strategies in order to prevent a sexually...
Here are treatment of STD. Use of antibiotic prescribed by a healthcare provider. However, it does not reverse damage, but it only prevents severe effects. Hospitalization for treatment, and lastly, surgery. And here are some preventive measures for STD. Using mechanical prophylaxis like condoms, abstinence of sexual intercourse, and yearly testing like appropriate sexual risk assessment.
Screening is still a recommended practice. It is confidential and can help prevent the spread of any disease. Anyone diagnosed as infected can be treated, and any previous sexual partners can be traced, tested, and treated if necessary.
HIV and AIDS first made the public's attention in 1980s. During this time, it was clear that modern antibiotics could not be used for this infection. A worldwide campaign was launched to educate a permissive public to practice safe sex and to be screened for STD before entering a sexual relationship.
If you were treated for an STD, have a follow-up visit to make sure the infection is gone, and continue to protect your health with regular screenings.
I wanna get chlamydia like no one's ever had. Herpes inside my butt and every kind of crab. Humping strangers July to June, spreading my baby cream. I'm gonna set a record soon, it's always been my dream.
STDs, gotta catch 'em all.
Across the map, I'll give it to see the clap. Oh, so come on down and take a tour through Scaly Town.
STDs,
yeah, like HPV, hepatitis A, B, and C. I do you and you do me. STDs, gotta catch 'em all, gotta catch 'em all. Yeah. My collection comes back in spades, Tokyo to Prague. I invented Kensyphilates and gave it to your dog. Sorry. Hey, is lupus an STD? In that case, I will pass. Is Ebola an STD? You bet your bloody ass.
STDs, gotta catch 'em
Get on your
all.
knees. I'm gonna give you mad cow disease.
STDs,
Oh, my heart is yours and it's as open as my sores.
STDs,
My balls are blue